My name is Chasity. I am a nursing student at the University of Mississippi Medical Center School of Nursing, originally from Starkville, Mississippi. I'm a non-traditional nursing student. I just turned 29 years old. So what attracted me to nursing was I do have quite a few illnesses and diseases in my family that I wanted to learn more about, and I was able to care for a lot of my family members during their time of illness. And as a student nurse, I've learned that nurses are the healthcare professionals who are at the bedside the most. And so they see everything and they have to be on top of everything. I just have a heart and I have a really high level of compassion for individuals, especially when they're in their most vulnerable states and unable to take care of themselves. So I would definitely say me being compassionate and also just wanting to be an advocate for my patients, especially for those who are not able to, maybe speak up for themselves if they're in need of a different type of treatment or plan of care. The nursing program that I'm currently enrolled in, it's a one-year accelerated BSN program. First starting off, it was a huge adjustment having to get used to meeting deadlines at a very fast rate, very fast pace, and just making sure I was staying on top of things. During my first semester, my clinical rotation was in the ICU, the intensive care unit. And so in the ICU, you see patients who are considered to be the sickest of the sick. During my second semester of nursing school, I was on the medical surgical unit, and in my final semester, which is now, I'm currently in the emergency department. So far, my favorite rotation and where I would like to work after school is in the intensive care unit. So within the next 5 years, I definitely still see myself practicing as a nurse, and I hope to maybe enter into the classroom and become maybe a nursing professor, and also just continue to be an advocate for patients and students who wish to enter the healthcare field, especially minorities, just because they're desperately needed in healthcare. I would hope to be a nurse that patients feel safe around. They feel like they can confide in me and find comfort in me. I would hope that my patients know that I am doing my best to provide them with the best care possible. And I hope to just be a safe, competent nurse. My fears, I would definitely say, considering nursing, it is a profession that requires a lot of you. My fear is facing burnout, but I do believe that I can combat that just by having like a work-life balance. I would say one barrier I faced in nursing and just getting into nursing, I would definitely say imposter syndrome, meaning just questioning like, am I good enough to be in this profession, or do I have like the education level or the skill level that's needed to be in this profession? So pretty much imposter syndrome, just second guessing myself. But now that I'm in the profession and now that I'm almost done with school, I can definitely say that imposter syndrome, it can get the best of you, but definitely just believe in yourself and just realize that there will be certain barriers that you might possibly face, but the biggest barrier is just make sure you have enough confidence in yourself to get through. So I would definitely say that's one of the biggest barriers. You don't see a lot of minorities, and so it does make you feel like you have to almost achieve a certain level of perfection in order to be valued and respected and seen. And it makes you feel as though like you can't make almost any error. And if you do, then that era is pretty much, it's not erasable. So I think that's one barrier, but one reason I entered the profession is because I want other individuals, other minorities to recognize and realize that it is possible to enter this profession and do well and be successful. And just by seeing me do it, hopefully it will help others realize that they can do it too. Advice for students wanting to enter the nursing field, I would just say, just go for it. It can be a little bit intimidating, or you might have some sort of fear at first. Work hard and just remember your why. And specifically for minorities, I would definitely say go for it. We're definitely needed in the healthcare profession to serve as a face of representation and to serve as a face of hope.